Hello, Instagram people and Facebook people. It's so good to be with you all this morning. As you can see, we are talking about poop, and I'm just gonna let people trickle in here. So let me know where you're from, what's going on, with your animals, what makes you particularly interested in, poop. And start putting some comments, some questions in the comment section as well, so that I can pick up on some of your answers. But anyways, good morning. Hi, Michelle. Good to see you. Nazli on the other side here on Instagram. Yeah, so good to see you all. I'm always happy to talk about poop, as you guys know. One of my favorite topics. And there's a reason for that, and I will get into that. So anyways, yeah, let me know where you're from. I'm assuming you can hear me okay. Yes? No? I assume so, otherwise I would probably have seen some comments. Oh, Dublin, Ireland. Hello. I will be in London soon, so if you want to take a trip. Yeah, poop is a wonderful subject. Yeah, it certainly is. From Fargo, North Dakota. Hello, hello. Oh, good. Thanks, Michelle. Glad to hear. All right, very good. You guys can all hear me. All right. Yeah, just gonna give people a couple more minutes to kind of trickle in. So, yeah, I'll be in London, I think from the 2nd through the 7th of January. So it'll be fun. Just hope the weather is going to be good. But of course, in the wintertime, one cannot expect it to be warm, I guess. But at least I can get out of Chicago for a minute. Although it's not been too bad. All right. Anyways, yeah, so have any of you guys gotten some new puppies or kittens recently, or some new dogs that you added to the family? Or if you know somebody who is, make sure that you share it with them as well, because there's so much good that can come from taking care of the microbiome. And I want to make sure that all the people out there who are getting puppies are more aware of what can be done and how important it is. So send a link to the breeders that so that they too can start to set up your puppy or future puppies for a good life early on, with less damage to the microbiome, because there's certainly a lot that we can do. All right, so very good. I think I'm just gonna get started. I do want to talk a little bit about the microbiome and how it even comes into the puppy. And for those of you who don't know what the microbiome is, it's basically an assortment of microbes, trillions of them really, that are in and around the body. So they're on all the surface areas that have a connection to the outside world. And in humans, we even have microbes in the brain. And that's probably why our brain developed to be bigger than some other species. So dogs and cats don't have microbes in the brain. At least they haven't found any yet. Maybe there are, who knows? Because we are learning so much with about the microbiome. Research is really exploding when it comes to that, and it has become quite mainstream to do research in the microbiome. So in any case, the microbiome, I mean, most of the microbes that are in and around our bodies are really inside the gastrointestinal tract, and that goes for our animal friends as well. And so when we talk about microbes, we often have that kind of ick sort of feeling going on, but they are really quite essential for all body systems, for everything that's going on in the body. So for brain development in a puppy, very important. And I'll talk a little bit more about that. Development of the, of the heart, of the gastrointestinal tract itself, education of the immune system. And nowadays we see so many diseases that have an immune component, any of the chronic diseases basically that we see, allergies, cancer, GI issues, inflammatory bowel disease, ear infections, autoimmune conditions. All of these things are influenced by the microbiome in the gut. And so when we work on creating a healthy microbiome, then an animal can live longer and can develop better, because we tend to forget a little bit that in the process of a puppy or a kitten growing and developing, that's when it is extremely important that we do things really well and provide them with a really good diet, and not wait until later because a breeder said, well, you should wait until blah, 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 whatever year, however old they are, to start them on a good diet. But no, you have to start a puppy or a kitten on a good diet, because it needs all of the nutrients in order to build itself, and when they're puppies, that's when the building is happening. So if you're waiting until later to try to compensate for what they may not have had as puppies while things were building, you may not be able to get to the point that they could have gotten if you had started early. Because it's like building a house with a cardboard foundation, cardboard walls and everything, and then they start to fall apart, later on in life, and then you have to start to patch up things. So it's much better to start out with a really good foundation and good building blocks and a healthy diet and healthy microbiome, so that the body can really develop to, as its highest potential of health. So the first few weeks and months of life are extremely important for development of a puppy. And what do we do when we have puppies, right? We deworm them on a regular basis. So we put in antimicrobial drugs into their system that also then contribute to an imbalance of the microbiome. Or we give them heartworm preventatives that also affect the microbiome. Or if they have diarrhea, we give them metronidazole, which that pretty much wipes out the microbiome entirely. And they don't recover from that very quickly. And very oftentimes, puppies that have had Giardia and were put on multiple rounds of drugs, because Giardia has become quite resistant to drugs, well, those puppies then end up with chronic GI issues for life. So it's really, really important that we take everything that we do into consideration and be really careful. Because when puppies are really young, until they're about 3 months old, there's a lot of change in the microbiome that can happen, and it's also much more susceptible to whatever we do. Because puppies between 5 to 14 weeks of age or so, 25% of them will have diarrhea at some point, and a lot of them will be put on either antibiotics or metronidazole or some other form of something that then goes and kills the microbiome. And so then they are not set up with a good microbiome. And we have to go even further back, because how do they get the microbiome in the first place, right? So they get it when they're born. So as they're being pushed out through the vaginal canal, they get inoculated with microbes. And then they also get microbes in the environment. But basically, if the mom's microbiome was not as good as it should be, then they already are not inoculated with the microbiome that they should have. But it goes even further back than that, because science has now found that there are microbes already in the meconium, which is basically their first poop, which is consists of accumulated material from the fluids that they're surrounded in the placenta, because they do swallow that fluid, and so that then comes out as the meconium. And so it's really important that, well, anyway, scientists have found that there are already microbes in that meconium, which means that there are microbes in the placenta, and in the fluids that they're exposed to. So the uterus itself and the placenta and the fluids in there are not sterile, and that's something new that has been discovered. And in the human field, what they found is that microbes are being pulled out of mom's microbiome in the gut into the bloodstream, and then through the bloodstream it then goes into the placenta, and that's how babies already are pre-inoculated before they're even born. So if mom has a poor microbiome to start with, then the microbes that are getting into the placenta and the fluids there are maybe not as good as they could be. So the puppy is already born with a microbiome that is less than ideal. And like you said, Michelle, like you're right. I've heard that puppies born by a C-section can have issues because of not getting mom's microbiome during birth. And that is true. They have found that puppies that are born through C-section, for one, have a bit of a different microbiome to start with. And they also have, I can't remember if it was that they had less microbes, but in any case, it was delaying their growth. So they weren't gaining weight as quickly as a puppy that was born naturally, through vaginal process. So it's very important that we kind of go, take all of the things into consideration to prepare a puppy for a good life. And that's why it's so important to, pick a breeder who is going to do things a bit more naturally, and isn't just, freely giving out, metronidazole like it's going out of style, and deworming unnecessarily, and vaccinating at the wrong times, and all of these things, because all of that will affect the microbiome. And also, what are they feeding mom? So if you're looking for a puppy, I highly recommend looking for a breeder who is naturally rearing the puppy, and same for the kittens as well, so that you already have a much better chance of having a puppy or a kitten that is going to be healthier longer because they were set up properly. So that's kind of, the microbiome. But then once they're born, the microbiome will shift quite a lot, because first they start drinking milk, and so the microbiome is geared more towards milk. And then as they transition into eating real, real food, then their microbiome will shift. And by the time they're about 3 months old, the microbiome is already pretty set. So research has shown that there's not a whole lot of change in the microbiome between 3 and 12 months old. So, by the time they're about 3 months old, the microbiome is pretty set. But of course, the microbiome is can be influenced very easily through diet. So if you're feeding a diet that's higher in carbohydrates and lower in protein, then the microbiome will adjust to that, and you'll have more microbes that are, able to digest carbs rather than microbes that are digesting more of the proteins and the fats. So, the diet has a huge influence on the microbiome. So and also the more processed the microbiome, the diet is, the more legumes it contains, the more corn it contains, or wheat. All of these foods are high in glyphosates and other types of pesticides that will then cause microbiome disruption, because they are antimicrobial, basically. So what you're feeding has a huge impact on the microbiome. And something that has also come forward is that if we don't feed enough fiber, then there's also a bit more of a lack of diversity in the microbiome. So basically, with a microbiome, we want to have a lot of different microbes, because they each have different functions. So we don't want to have just one good microbe. We want to have a lot of different good microbes, so that they can really do the job overall well.
It's a bit like just having 20 of me and nobody else. I mean, that would get really boring because all I can do is talk about poop, right? So maybe you also want somebody who can talk about something else and not, get you all bored after a while. So it's the same thing with the microbes. We really have to have microbes that, like a large diversity of microbes. And unfortunately, on this planet, we already have decreased the microbial diversity in general by about 50% because we're using bacterial everything, antimicrobial everything. We're basically still kind of in the phase of trying to kill everything rather than to support things. So that's definitely a big shift that needs to happen. And, obviously it's a big shift that needs to happen for our animals as well. So diet plays a huge role in what types of microbes you will have, and that's why it's important to have a diverse diet as well. So switching things around, providing fiber, which also helps to nourish the microbes because they need food as well. So when we provide them with fiber, they can then, thrive more because they are being nourished. And that's something that is seen a little bit more with those who are only feeding a prey model that doesn't contain any type of vegetable or much fiber at all. Those microbiomes have been shown to be a little bit more less ideal, I guess. But yeah, rotating diets, rotating proteins, rotating different types of brands, different vegetables, a little bit more minimal on the fruits, but, berries, etc. So just rotating a lot is very important, and providing them with a variety of food so that the microbiome can be more diverse as well. And then we also need to be a little bit careful, obviously, with providing a lot of dewormers and all those types of things that affect the microbiome. In fact, I did have a puppy who I saw recently, and he had Giardia. And at the same time, he also started coughing. So the owner started him on a cough herbal supplement that also had a little bit of antimicrobial properties to it when it came to Giardia, which is good. And then he also put him on, he got worried. So the dog ended up on doxycycline, which obviously affects the microbiome as well, but it would not have an effect on Giardia. So basically what we then did, once the antibiotics were done and cough had resolved and so on, we just basically provided him with fecal capsules. And then we checked his fecal matter once a month, just to see, what was happening with Giardia. And after about 3 months, there was no trace of it left. So this dog never had diarrhea. So I didn't think that we really needed to go pull out the big drugs because, again, there's so much resistance when it comes to Giardia, with the drugs that we have available, that, the consensus is a little bit more that we shouldn't treat unless they actually have diarrhea. And so I figured, well, let's just do fecal transplants. I sent him home with some fecal capsules, and then he actually got rid of his Giardia. And another puppy I recently worked with as well had Giardia, and she had massive amounts of Giardia. Again, no diarrhea. And the owner decided to go with an herbal formula, and the dog cleared up the Giardia as well. And she was also giving fecal capsules to that dog, and so that basically took care of it. So, before we get into total panic mode and have to get rid and kill something, it's worth exploring other options and other ways that can be more supportive and less damaging down the road. Because, as I mentioned earlier, metronidazole, for example, really destroys the microbiome, and some animals never recover from it because they are then set up with a microbiome that doesn't work. And because that microbiome doesn't get fixed, it just continues with the whole inflammatory cycle. A lot of dogs that have chronic inflammatory bowel disease issues, they oftentimes started out with Giardia and a round of metronidazole, and then that's kind of where they ended up. Obviously, there are other causes for that as well, but certainly it starts from then when they're very young, because nature would never set them up to have diarrhea the rest of their lives or vomiting the rest of their lives. That's not how it's set up. In nature, puppies would be outside. They would start eating a little bit of poop from mom. They would roll around, lick each other's butts, and all the other disgusting things that they do. But that's how they are able to restore their microbiome and enrich it. And that's why when people ask me about, should you let your dog eat poop, or if they ask me, what can I do to stop my dog from eating poop, I usually say, well, why is your dog eating poop in the first place? Is it trying to self-medicate? And so, obviously I don't recommend that they just eat random poops, because there could be pathogens in it there that you don't necessarily want, or they could possibly have been on medications that you don't really want to have your puppy ingest. But if you know that it's from a dog that's eating a healthy diet and is healthy overall, it may not be such a big problem. If they eat that poop, it may be very helpful. And in fact, I do have one client whose older dog has had several fecal transplants because he has some food sensitivity, and one person in the family leaves crumbs of corn laying around, and so he kind of gets, the inflammation sort of keeps going. So in any case, we've done several fecal transplants on him, and then they added 2 other dogs to the family, and these 2 dogs will only eat his poop, not their own or each other's, but only that older dog's poop who has had fecal transplants. So they know what they need. And another person I know, who's also here today, she has quite the herd of dogs, and one of them has some microbiome imbalances as well, or a little bit of tendencies to GI issues. And he will only eat the poop of those animals who are balanced well from an emotional, mental perspective. So they can choose what they need, and they will not just eat their own poop or other dogs' poop, but they will eat rabbit poop or horse poop, like for example, one of the dogs I used to take care of, she was a little white poodle, which she was eating horse poop, so like she was this little prissy little dog eating dog poop, horse poop. But in any case, when I'd go for a walk, she would only pick on some horse poops, and others she would completely ignore. So they have a way of self-medicating and adding what they need, and maybe with horse poop more so that they are adding some fiber that they need, because obviously the fiber has already been broken down some, so it's a little bit easier for the microbes in the gut to then digest those. So just because an animal is eating poop doesn't mean that it's a bad thing, but obviously we do have to, pay attention a little bit more, and I would certainly recommend doing a microbiome test in those animals just to see where they're at. But anyways, I want to get a little bit back to the development of the animal, because the microbes in the gut, they produce all sorts of nutrients and chemicals that are necessary for proper development, so for proper education of the immune system, so that the immune system can distinguish between foreign and not good, foreign and good, and just good. Because for example, if a dog eats chicken, if the microbiome has trained the immune system to tolerate chicken, then it will be able to eat chicken and process it and derive nutrition from it. But if the microbiome somehow missed educating the gastrointestinal tract and the immune system that chicken is a good thing, then the animal will become sensitive to chicken and have a problem every time it eats chicken. So it's very important that education is happening, and that happens very early on. And again, that's why it's so important to feed different types of foods and not stick with one brand of dry food that is made for puppy growth, or whatever it may be. So you want to have a variety. And these microbes, they send neurochemicals up into the brain as well and help the brain to develop properly. And what they found in humans, if the brain, if the baby didn't have a good microbiome by the time they're 5 years old, the brain wasn't able to develop the way it was supposed to develop. And once they reached that 5-year mark, no matter how well they fixed that microbiome, the brain was never able to then catch up on on that development. And what do we see a lot these days? We see a lot of kids that have behavior issues, developmental issues, autism, ADD, ADHD. And what do we see in animals? I see a lot of puppies who already have a high level of anxiety. They're already, maybe a little autistic in that sense. They're afraid, they're more aggressive. I remember one puppy, she was 4 years old, and she was so aggressive. And not just playing, she would literally attack, and not in a good way. It was like she was a little crazy in her brain. So that is very important. And there are things that if you don't get them by the time they're hitting a certain age, they're never going to be able to make up for that as much. And that's why it's so important to make sure that the gut and the microbiome are healthy for that. So after all of this, let's just talk a little bit how I approach it. So if I get a puppy, I just assume that they didn't get the right microbiome from mom. It probably is going to be imbalanced. They may already have a little bit of leaky gut going on. So what I want to do is I'm basically starting with the assumption that things are not quite right, because most likely they are not quite right. And certainly we could potentially do testing, but in puppies I probably wouldn't necessarily do a biome test until they're about 6 months old, just to allow the microbiome to develop. So I basically focus heavily on the gastrointestinal tract in the first visit and following as well, because that's also where most of the issues can start, with diarrhea, coughing, whatever it may be, because 80% of the immune system is in the gastrointestinal tract. So focusing heavily on the gastrointestinal tract from the get-go is very important to avoid a lot of these diseases that they could potentially have as puppies. And so what I do is I provide them with a better diet, with a diet that is more species appropriate, so low carb, rich in protein, and really balanced as well, because you definitely want to have a very balanced diet when you're growing a puppy, because if there are certain nutrients missing, again, you end up with cells that can't be functioning properly or built properly because certain nutrients are missing. So it starts with diet. But when we look in the wild, how are puppies actually getting food? So they're getting milk from mom or from the nursing, the other nursing dogs. And then as they're switching over to a more solid diet, how does that happen? Well, mom goes out and she hunts and she ingests the food, and then she comes back and regurgitates that food for the puppies to eat. So while she's moving back, she's already starting to pre-digest the food. So the food that the puppy is getting is already mixed with stomach acid, other gastric juices. And so when mom plops that out, that pre-digested food is going to be much easier on the digestive system of the little puppy, because they don't have that digestive capability yet that an adult dog would have. It's not as strong yet. So as they eat that pre-digested food, they are getting some of these enzymes and gastric juices already with it, which then helps with the digestion and the utilization of the food. So how can we mimic that? What we can do is we can add some enzymes to a puppy's food. And I recommend that very much so to all of my puppy patients, because again, I want their food to be digested properly so that they can get all the nutrients out of it. So I usually put them on some pancreatic enzyme, because pancreatic enzyme is more what they would have, naturally. Um, Certainly you can do plant-based enzymes as well, but I do like animal-based enzymes more so. And so what I use is, for example, a good one is Dr. Mercola's enzyme. It was designed by Dr. Karen Becker. That's a really good one. And then allergy research, something or other, allergy research. Yeah, if you Google pancreatic glandular or pancreatic glandular, you'll find that it's allergy research something something. They have a good one. It's just capsules that are basically freeze-dried pancreas, so you can just open it up and add it to the food. So those are things that you can do to help with digestion. And certainly also using something that has been blended really well and is really small, and that already helps as well, because it's already broken down some that way and helps with that. Yeah, RXzyme can work too, but it doesn't have any pancreatic enzyme in it. So um, RXzyme I would use more so for adults, and then also for those who I suspect may have potentially have sensitivities to pork, for example. So I would want to put them on a plant-based enzyme. So RXzyme is more of a plant-based enzyme. And then I also put them on some colostrum, because colostrum is like the first milk that they get, because in the first, I think it's 24 to 48 hours, their gastrointestinal tract is very leaky. So when they get the colostrum from mom, that is very rich in antibodies to different diseases, these proteins that are relatively big, they can go through these holes in the gut lining without having to be without being digested and destroyed. But after about 24 to 48 hours, that lining then starts to seal up, and so these antibodies, they can't go through anymore. But just providing them with colostrum can just help with local immunity. So colostrum, again, is the first milk, and that's so rich in all sorts of really amazing immunoglobulins and other nutrients that it can be very helpful for the gastrointestinal tract and immunity in general. So I usually send them home with a jar of colostrum, and start them on a third of a teaspoon per 25 pounds of body weight twice a day. So that's usually what I do. So enzymes, colostrum, and then I also send them home with fecal capsules. I don't use probiotics in my practice anymore because I have found it to not be all that useful. First off, the microbiome in the gut has so many different species of microbes, somewhere between 500 and 1,000 different species of microbes. And these microbes in the gut are anaerobic microbes, which means that they thrive in an environment that doesn't contain oxygen. Probiotics, on the other hand, are mostly aerobic microbes that thrive in an oxygen-rich environment. So you can already see from that a probiotic who has microbes that live in an oxygen-rich environment are probably not going to do all that well in an oxygen-depleted environment, and they're also not the same kind. So basically with probiotics, what you're doing, you're basically adding something that isn't really even native in the microbiome. So what's the point of giving them something that doesn't actually live there? Certainly, there are studies that are showing that certain microbes probiotics can help with diarrhea and things like that. But, to be honest with you, with probiotics, you're getting like 1 to maybe 10, 20 species of microbes if you're lucky. And the rest, what about the rest of the 500 to 1,000 species? So you're not really getting a whole lot. And so I don't like to waste money. I don't like to fuss around. I'm somebody who goes right to the point, and that's the same way I approach healing. I go right to the point. So probiotics, to me, that's more like the drama or the beating around the bush type of thing. So I'm much more, direct, and I will use fecal capsules instead. So I send my puppies and kittens home with fecal capsules, and have them give, the fecal capsules. And how often and how frequently and how long depends a little bit on the history of the animal. So if I know that they've already been on my metronidazole, I will do, daily capsules for at least a month. If the dog was raised in a pretty good environment, doesn't have any diarrhea or any major issues, I may say maybe 3 or 4 capsules a week for a week or for a month or so. And then we can always test the microbiome later to see if it's really well developed, and then always do more. So it depends a little bit on what I would do, but so that's usually what I send them home with. And then another thing that I also will provide them is a homeopathic remedy to help protect them a little bit more from parvo. It's a parvo nosode. So it's a homeopathic remedy, and I follow Dr. Todd Cooney's protocol, who gives a few pellets once a week until they're 6 months old, just to help support them with that. So as you can see, most of what I do with my puppy patients is really to focus on the gastrointestinal tract, and setting them up for a really ideal life and ideal health, to really maximize that. Yeah, all right. I think that's enough of me talking here. So I'm gonna see what questions you guys asked. I know there were quite a few. All right, so Christine, you asked, what do you suggest, what fibers? Well, you can use sunchokes, you can use a little bit of cooked artichoke, you can use inulin, which is, comes in a jar, psyllium husk. There are a lot of prebiotics, because these fibers we call them prebiotics because they're basically nourishing the microbes, so biotic. So you can use that. And just a variety of vegetables. There's not like one particular prebiotic or fiber that's necessarily better than another. I think, again, variety is a good thing, and feeding with the rainbow, basically, so feeding a lot of different colors is really helpful too, because it adds more nutrients as well. All right, Michelle, microbes are like an orchestra. Oops, disappear. Are like an orchestra. The music is richer than an individual instrument, and then when they are in sync, it's beautiful. Yeah, that's a really good analogy. I should use that. Thank you. Yeah. And then Christine, you had another question. What do you suggest with thyroid? Both my dogs on one test the vet said they both have low thyroid. Is there more extensive testing that needs to be done for thyroid to be sure this is what they have? I'm finding it hard to believe that they both have it. My girl, she's not gained weight since she's not drinking tons of... Okay, and it sort of breaks up. Yeah, so I don't want to focus too much on that. This is a microbiome talk and a puppy talk, but definitely doing a full panel is helpful. And, thyroid levels are very much affected by the environment these days, because there are a lot of things that are a lot of toxins that are affecting the thyroid gland. And obviously, to kind of bring it back to the microbiome has a huge impact on the absorption of nutrients that are necessary to make thyroid hormone, for one, including iodine and different amino acids that then, can turn into thyroid hormone. And it also plays a huge role with the liver, with processing, hormones, because hormones are all have to go through the liver on the way out, and the liver is also very important for conversion of T4, which is the inactive form of thyroid hormone, to T3. So if there's something not right in the liver, that can also prevent that conversion from happening. And so because the microbiome has a huge impact on bile acids, liver function, detoxification. It's very, the microbiome has plays a role in thyroid health and thyroid development as well. So when we think puppy and kitten, the microbiome plays, is just extremely important for any type of process of development of all organs. Every single tissue is going to be affected by that. Jennifer, thank you for all that you do. Well, thank you, Jennifer. That's nice of you to say. All right, so Claire, we are unable to get fecal capsules here in the UK. How can we help reset the gut microbiome without using fecal transplants? Well, you can find a donor who is healthy. So kind of scour around your neighborhood, your friends, and find out, what are they feeding? Are they feeding them a really good diet? Are they keeping the vaccines low? Are they not, getting it? Have they, if they should never have had antibiotics. They should, be minimally, exposed to toxins such as, toxins, environmental toxins, toxins in the household, etc. And then find one that's a little bit older already, who has had a life, of vitality and health and is still looking really incredibly good. And then start doing a little bit of testing on that dog. You can do a biome test. I'm not sure if you guys are able to send out samples from England to the US. If not, I'm going to be in London. So I could always take something home and send it out. But anyways, that could get me into trouble. But in any case, so that's certainly an option, is to find a donor nearby, because you don't have to have fecal capsules. You just have to have a donor dog who has really good poop. But certainly you want to do a bunch of testing before you, before you take it as him as a donor. But again, follow your dog's intuition. If your dog is eating poop somewhere, then maybe that's a good thing, and it's getting its microbes that way. And certainly spending a lot of time outside in nature is also a very important component to help that the maturation of the microbiome and provide more diversity, because dogs and cats, they will roll around in the dirt and lick themselves, so they get microbes from the soil as well that are then enriching their microbiome. So you want to make sure you spend a lot of time out in nature, obviously in areas that don't have a lot of pesticides that are being used. But unfortunately it rains everywhere, and there's toxins everywhere. I hope that helps, Claire. All right, then Lori, if your puppy is weaned to raw and you can continue feeding raw, do you need to adjust the percentage of protein you feed the puppy versus what you would feed an adult? I would find a food that is made for puppies as well, that is for all life stages. And obviously it depends a little bit on the size of the dog, or what breed the dog is. Some of the larger breed dogs, you have to do a little bit more adjusting that way. Oh, thanks, Dawn. Yeah, allergy research group. Oh, and Michelle posted the link. Thank you. Yeah, I mean, yeah, they also have bottles that have less than 720 capsules, because let me tell you, it's a big jar. All right, and then Josie, good morning, Dr. Suter. It's exciting to learn you were so amazing with my first naturally reared puppies. Oh yeah, I know, they were so cute and they're doing so well, right? And then, oh yeah, Michelle, you posted the enzymes as well. Thank you for that. All right. And then Suki, you asked, would you offer colostrum for middle-aged dogs for gut issues? Certainly you could try. When they do have gut issues, there are certain things that will work and certain things that will not work. And oftentimes we won't really know until we try. But definitely, if you have a dog who has ongoing gut issues, you'd want to probably find out if they have a sensitivity to dairy products. If they do, I probably would stay away from colostrum, because that could just aggravate things. So you want to just be a little, discerning on that. I like to run the NutriScan It's a food sensitivity test based on the saliva, where they actually measure IgA and IgM, I believe. And so that way it gives you a bit of an idea what you can and can't feed. I mean, it's not 100% accurate, but it gives you a pretty good idea, because doing food trials, that can take you months to figure out, and it's not all that accurate. Because if you give chicken, for example, it can take up to a week for it to start reacting to it. And by that time, you probably already tried another food, and then you think it's that food that caused the issue, but it was still the chicken, before that. So food sensitivity testing, I find, is a little bit more of my go-to with when they have issues. What potency no sods? I think mine is a 30C. Terry. Linda, do you like standard process supplements? Yeah, I do, because they do have a lot of glandulars and things that can also help the gastrointestinal tract. They have different types that have that also have a little bit of ox bile in it, a little bit of stomach, a little bit of betaine HCl, which is basically stomach acid. So these things can be very helpful. But again, what I already gave you as far as the recommendations that or what I send people home with, those are my go-tos. And then the other supplements like standard process and such are a little bit more depending on what I see. And that reminds me, I forgot about one of the supplements that I always use for my puppies as well. It's called Ion Gut. It's from Intelligence of Nature. And that one helps mitigate a little bit of the issues from glyphosate, because all of us are now exposed to glyphosate. It's in a very high number or high percentage of all air samples and water samples. So Ion Gut really helps with the immune system. It's basically a communication molecule, so it helps communication within the body. And communication is really important, because without communication, we all know what happens, right? We end up at like a Christmas or a Thanksgiving dinner and everybody's yelling. So in any case, that Ion Gut helps with communication between cells, between microbes, and that overall helps to hydrate the body better and also keep it healthier, and support things. So I usually send them home with that as well, at least one bottle of it. And it's kind of like water, you just add it to the food. It's very easy. And then Astrid, do you have any advice specifically for kittens, or is that the same as for puppies? Yeah, I would do the same for kittens. The only thing is that if you have a kitten that's like yay big, or a puppy that's only really tiny, because it's a tiny breed, you may have a little bit more challenges with with the capsules, because they might be a little bit too big. Generally, I don't recommend opening the fecal capsules from that you can get from Animal Biome, and I do recommend the raw ones. They are more expensive, but I prefer the raw fed ones, because they come from dogs that live out in the boonies, have been on a raw diet for generations, minimally vaccinated. I mean, like, those are like the perfect donors, really, or as perfect as they can get. Anyway, so generally I don't want to open up the capsules, because the capsules are coated so that they pass through the stomach without being digested and then get into the small intestine, because we want the microbes to get into the small intestine. But if you have a tiny little kitten, and even though the capsules are pretty small, you may have a big problem getting them down, because you obviously don't want to end up having them choke. So if you have a tiny little kitten, I would suggest to just open it up, and then maybe mix it with a little bit of milk in a syringe, and then squirt it into the mouth, so that they can swallow it. They will still get benefit from that, for sure, because in the wild, if they eat poop, it's not wrapped in a nice little capsule, right? It's the disgusting kind that then hangs on their fur. Anyways. Yeah, so basically, yeah, for kittens, I recommend the same thing, variety, feed them different types of foods, different consistencies, You know, feed them a little bit of canned, feed them a little bit, you know, raw, feed them freeze dried. If you know, add a little kibble here and there, just so that they're getting used to all the textures, because cats are very much into textures. So if you switch around, if you never switch around textures, it's going to be much more difficult in the long term to do anything. You know, food wise, and switch them around, because they're going to think you're trying to poison them. So definitely you want to do a lot of variety with kittens as well. Josie, how do I keep my puppies being balanced? I read about Alfred Plechner and it was interesting. Yeah, so Plechner syndrome is a different thing that can also contribute to GI issues, and can contribute to some of these chronic things, because Plechner syndrome is basically a deficiency of cortisol, where the adrenal glands are not making sufficient amounts of cortisol, and that can end up having, you know, resulting in all sorts of imbalances in the immune system, including, you know, a dysregulation of the immune system, and also gut issues. So in animals that tend to not hold on to their microbiome very well, where you test over and over again and it's not getting better, oftentimes they will have Plechner's syndrome, and you can read up on it online. But I find that his book is actually much better, explains it much better. It's called Pets at Risk. It's available on Amazon. It's already a few years old, and but it still applies. So I highly recommend reading the book over the website, because I found the website to be really kind of confusing. It's not very well designed. So anyways, yeah, so Plechner syndrome, if you have an animal with chronic GI issues, you definitely want to investigate that, because basically we have Addison's disease, where they don't make any adrenal hormones, and that's like the extreme. But you can have anything between like a normal healthy adrenal gland that produces adrenal hormones to full-blown Addison's, and I find that a lot of dogs are somewhere in between, and that can also result in GI issues. So you definitely want to kind of read on that. So how do you keep your puppies balanced? Well, that's by doing all of the different things that are necessary to support the body. And, you know, I posted a link earlier about my free webinar on the 7 pillars of health. And that's really what it takes to create really good health, and reverse disease, and maximize, you know, optimize an animal's health, you know, bring them up to that potential that they have. Obviously not, you know, some of them have a lower potential that they can reach than others, but it takes the 7 pillars of health, and it also takes rethinking how we approach medicine and disease and healing, because, and I don't want to go into that too much, but basically we used to think a pill for every ill. Now we have a supplement or a probiotic or an herb for every ill. But the thinking has to change, you know, because that's still just using a Band-Aid, you know, to cover up the symptoms, basically, but we just use more natural things. But that's not how you need to think about medicine. You have to ask questions in between. How did it get from healthy to diseased? And then you'll get the answers, you know. So you have to ask questions. You have to find the underlying cause, and I go into that in much more depth into, you know, in my free masterclass that you can, as I said, it's free. You can sign up for that. It's one of the top links, and it's also on my website, the top banner, so you can find it there as well. All right, so that would be, you know, balancing, looking at all the 7 pillars. Oh, hi, Betsy. Good to see you. And then Tina, you say, my puppy cries when she poops. I've taken her to internal medicine, and I can't seem to get her. Oh, I'm assuming you say you can't seem to get help from her for her. Well, again, you have to do some testing and figure out things. I'm not sure, are you talking about an actual puppy, or are you talking about an adult dog? yeah, I would need a little more help with that. But definitely, it seems like later down you say it was rock hard when they gave her lactose. It was rock hard. Let's see if there's anything else that you're saying here. And thank you so much, Michelle, for being my assistant here, posting all the links. I appreciate that. Yeah, so obviously we'd have to figure out a little bit more of what's going on, Tina. I would certainly check into the microbiome. What does the microbiome look like? What diet are you feeding, or is there fiber in the diet, etc. So that's not a very simple answer. I mean, if you wanted to add a little bit more, another comment here to give me a bit more information, I might be able to help. But again, it's also looking, with any sort of GI issues, and I know we're talking a little bit more about puppies and kittens right now to set them up for a good, healthy gut. But if you already have an animal that has an unhealthy gut and, constipation, vomiting, diarrhea, reflux, whatever it may be, then you want to make sure that you do some proper investigation of what's going on, and then use the 7 pillars of health to help to restore that, because it takes more than just diet to fix the gastrointestinal tract. Nowadays it takes more than just a good diet to fix just about anything. 20 years ago, you could just change the diet and the animals would heal. Nowadays, unfortunately, that's not enough, because we live in an environment that's so polluted and deficient in nutrients as well, so that then the animals, their cells can't function as well as they could. So read up on watch my webinar. I also have an ebook on my that's available on my website, about the 7 pillars of health, and then of course my book. Well, in my book I think I only have 6 pillars of health. I added another one because mental and emotional health is really important. So for any one of you who've read my book, there's a 7th pillar. But in any case, you want to really address all of the things, because if there's constipation, for example, it's also possible that the nervous system is not innervating the gastrointestinal tract the way it should, because maybe they're walking around hunched up, and so then the nerves that are innervating the gastrointestinal tract are not, innervating it well enough for the motility of the gastrointestinal tract to be normal. So then things get stuck and don't move as well. So you definitely need to look at all aspects of things. And then also looking at hormones, because hormones can also cause constipation. For example, as my estrogen levels were going down as I went through menopause, I had I was more constipated because I didn't have enough estrogen, and I, by accident, sort of figured it out because I started putting on some estrogen cream, and then that problem resolved. So it could be hormonally induced as well. Low thyroid levels can also cause constipation. So yeah, you have to look at the whole package, not just one thing. And as much as I like conventional vets, I love what they do, and the assistance that they provide when it comes to some of the GI issues and such. I find that oftentimes things are lacking. Some testing hasn't been done, or the testing that I do hasn't been done. So working with a holistic vet can certainly be quite helpful that way too. And I do have a mentorship program. People tell me, you never say that you have a program. I'm like, okay, I have a program. So I have a mentorship program where I go through the 7 pillars of health and support people with their questions and such. So it's quite, yeah, we have an amazing group of people in in the program, so you can get a lot of help through that as well. All right, and then Suki, thank you for answering my question. Very helpful. You're welcome. All right, and then Dawn, we took your NutriScan. Well, it's not my NutriScan. It's HemoPet's NutriScan, and then we got Animal Biome fecal capsules. We're about 3 weeks in, and Lila is having lots of skin eruptions, itchiness, ears, conjunctivitis, Is it common to have a die-off and exacerbating symptoms temporarily? Um, yes, it certainly is possible, and that means that, well, because the microbiome, if we have a microbiome, right? Each animal has one. And then if we're starting to add some other microbes in there, there's going to be a bit of a disruption in that microbiome, the existing one. And if we have microbes in that microbiome that die off all at the same time, because the new microbiome is coming in, and maybe we also switch the diet on top of everything, then we could have a lot of die off. And some of these microbes, when they die off and break apart, the parts, we call them lipopolysaccharides. These parts, they can be toxic to the body. So we call them endotoxins, so inside of the body. And that could certainly result in that. So if an animal is having a lot of skin issues and itchy eyes and all, ears issues and so on, you probably need to back off. And I would also, for my patients, if I had a patient like that, I would definitely also start to add a binder. So PolyPet, for example, has binders that you can use because they will bind some of these toxins. Chlorella can help with binding toxins as well. Activated charcoal, things like that can help to bind these toxins and get them out so that the gut is not so irritated. Certainly, I would also, for an animal like that, I would also, add ion gut, making sure that they get some enzymes, and then, see what else is going on. Probably look at hormone levels as well, just to make sure. And then if you did the Nutri-Scan, I'm hoping that you're also reading the labels of everything that you're giving, because a lot of times we can have hidden ingredients. So for example, a capsule could be made out of gelatin, which usually is made from beef. So if you're giving a gelatin capsule to a dog or cat who has a beef sensitivity, then that could cause flare-ups. So you want to definitely be careful about that, but certainly anytime they have, you know, symptoms like you describe it with doing fecal capsules, usually the recommendation is to back off and go to maybe one a day or one every 2 or 3 days, because you certainly do not want to have a dog that is so inflamed, because if you have such an inflammation going on in the gut, these new microbes that you're putting in are not going to be able to hold on as well either. So, you want to decrease the inflammation and help that inflamed gut a bit as well. And that may also be just feeding a very bland diet for a few days, or some dogs do really well with a little bit of fasting, because the body then has a little bit more time to get some of that gunk out, maybe adding a little bit of pumpkin to get things moving a little faster, so that these toxins get out a bit faster. All right, and then Suki, can you explain a bit more about glandulars? Well, I talked about the pancreatic glandulars. I don't want to necessarily go into the others because we're talking about poop today. Janet, stepping in late from snowy northern New York. Thank you, Dr. Suter, for always being so generous and sharing information. Oh, you're welcome, and thanks for coming, Janet. You're one of the people who always shows up anytime anyone is doing a live somewhere. Usually you're somewhere in the barn or walking your dogs. All right, Claire, interesting. I have an ACTH test booked. Okay, that was in reference to adrenals. Yeah, okay, very good. Again, ACTH tests are not always that accurate. I mean, adrenal testing can be a bit challenging because there's always false positives and false negatives that can occur, so it can sometimes be a little challenging to figure it out. Michelle, Dr. Suter's 7 Pillars program is fabulous. It changed my life. Oh, thank you. You changed my life too. All right. Johnny Palisi, is it over? I'm not sure what you mean by that, but I'm still talking. All right, Tina, she had coccidia 4 months at 4 months old. I assume that, um, yeah, 4 months old. Yeah, so if she had a lot of, treatment with protozoal drugs, or other antibiotics or whatever they used at the time, most likely the microbiome was quite imbalanced. So you need to just restore the microbiome. Um, Certainly. Agnieszka, hello. Dr. Suter, hello. Um, Johnny, all these toxins and exposures are so yuck. Yeah, unfortunately, that is true, and that's why we need to, vote with our money and not buy stuff that is loaded with toxins, and educate people. All right, Madison. My cat is having problems with vomiting and diarrhea. 10 years old. Started having problems with dry and tiki cat after dark. Went to vet, got antibiotics, helped a little, and started up again. Tried Vital Essentials, freeze dried. Yeah, so when they have problems with vomiting and diarrhea, then you have to also check what is going on with the microbiome, and also see, do they have any food sensitivities, because that can also cause that. And I do also find that a lot of cats have Plechner's syndrome, which is low adrenal function, and they can benefit with, from adrenal supplementation. So those are kind of the where I would take that, because I don't think that just changing diet is going to necessarily fix the problem. And anytime an animal has had antibiotics, no matter what, I will just put them on fecal capsules just to help restore the microbiome that was disrupted by the antibiotics. Agnieszka, I done many times microbiome transplant with microbiome test before. I saw how my dog's biome changed for the better after each transplant. I always recommend it to friends. Yeah, and it can take several rounds of doing fecal capsules or fecal transplants. And in animals that are really in bad shape, GI wise and allergy wise, I often will do a rectal fecal transplant and then send them home with fecal capsules to really kind of, hit that microbiome, that defective microbiome with a sledgehammer, basically, and really bring in the new troops. That's what I will do. But I have to say that when I started doing fecal transplants about 7 or 8 years or so ago, dogs and cats were still responding much better to fecal transplants than they are now. So nowadays, oftentimes I have to do multiple rounds, but it's still, much better than a probiotic. With a probiotic, you're never gonna get there. I mean, it's just, there's no point in wasting money. All right, where was I? Okay, here we go. Dawn, thank you so much. That was a very thorough answer. I appreciate it. You're welcome. All right, Robin, how do you feel about liver defense in a year-old pup? I'm not sure what liver defense is, but I definitely put all of my, patients on liver support, or seasonal detox, depending on what they need and where they're at in their lives as far as health is concerned. Madison was told that stressors to sugar, peas, legumes, and chicken. Thank you so very much. Yeah, I don't know what that means, because there are different tests available, and I generally use a Nutri-Scan. This one sounds more like it might have been an energetic stress test, which doesn't actually test any physical thing. It just tests more on an energetic level. So I don't usually use these tests very much, but anyways, it's worth doing the Nutri-Scan in case you haven't done that. All right, Jill, best way to heal a leaky gut, basically, which is what I talked about, with what I do for setting up the puppies, plus minus the colostrum. but testing what's causing it, checking are there any parasites there, and then helping to support the gut lining with different things. And I go into that quite a bit in my, not so much in the master class, but in the program. Definitely, there's so much that you can do. There's a ton of herbs as well that can help soothe the gut lining if that's what's necessary. So it all depends a little bit on what's going on in there, and what the symptoms are as well, because some animals will do, they benefit from having a little extra acid in their stomach, so providing them with a little bit of extra acid, like betaine HCl can help. Others have a little too much acid, so then you want to do a little bit more of a soothing type, and then just nourishing the gastrointestinal tract with obviously good diet, ion gut, fecal capsules, etc. And obviously, if there is a food sensitivity, you have to remove that food at least for a while, because otherwise it's like trying to extinguish a fire while you're still throwing oil on it. Madison, I've been trying rabbit. Now I'm giving turkey baby food and he's keeping down. Thank you so much for your help. Well, that's great. I'm happy to hear about that. It was muscle testing. Joined late. Where do I find Nutriscan? Check HemoPet, or if you just Google Nutriscan, you'll find all the information for sure. All right, very good. I think I covered all of them on Facebook. Now let's see what I missed here on Instagram. Don't want to leave you guys out, but oops, it's not what I wanted. All right. Okay. Let's just see. I know I saw some questions. Oh yeah, RXM. I already talked about that. Can you add pancreas if feeding raw? Yes, you can add pancreas. The recommendation is to stick it in the blender so that you can get to the the enzymes are more available. Interesting, makes sense. I have my puppy probiotics. Yeah. I mean, I'm not saying that probiotics don't work, but I just don't find them all that useful. And again, as I mentioned earlier, I don't like to beat around the bush. I go right for the, I try to hit the bullseye right away. It's just less work. Nutriscan is what I recommend to my clients. The canine dietitian, that's awesome. No, I'm going to London for fun. Well, if you wanted to meet me there, I mean, I'm going to be with family, so it's not necessarily that I'm going to meet people, but if there was something that I could bring or take back or something, we could certainly meet up. You can just reach out to me, vet@odettsuterdvm.com, or through my website. Do you recommend Boost from Polypet for gut issues? Boost can be good too, yeah, definitely. I like that. How common is hyperaldosteronism? Not that common. I'd have to go look it up. That's as much as I know about it. And then life with Rottweilers. My boy Lear is an animal biome raw donor. We are so excited to help dogs around the country in need. My girl Nami will be a donor too. Oh, that's so amazing. That's so amazing. Yeah, we do need more donors. So if you live in the San Francisco area and you have a dog or cat who's like super healthy and on a raw diet and everything, yeah, I highly recommend reaching out to Animal Biome. They're always looking for more donors for sure. All right, very good. I think I kind of, oh, Ursula. Oh, of course. Hi. I don't know. I never know who's who on the on Instagram, because the names are just different. Anyways, all right. I think I saw one more, and then I'm gonna stop here on Instagram. Facebook, sorry. Good diet for a 4-year-old Yorkie. well, the closer you can, Karen, the closer you can feed to a diet that they would eat in the wild, the better. But every animal is an individual, so I don't know anything about your Yorkie and what health issues or not it may have, and what you've tried and what you haven't tried. So I can't really give you more information on that, but the less processed it is, the better. And of course, it should be somewhat balanced. That would be ideal. Diana, with yeast, you have to avoid starchy veggies that feed yeast, carbs, sugars, etc. Oops. When trying to get rid of yeast. Well, why is there yeast in the first place? So instead of trying to chase yeast down, I would want to find out why is there yeast in the first place, because yeast is just a sign of imbalance. And oftentimes it's a sign that either thyroid levels are maybe low, thyroid is not functioning quite at the level that it should, microbiome imbalance for sure, but it can also be a sign of excess heavy metals in the body, and yeast has a tendency to gobble those up and help the body get rid of some heavy metals. So instead of doing like a low yeast diet, I would work on figuring out why is there yeast in the first place. And the other thing is too that everything in this world that has any sort of skin or ear or paw infection or something is called yeast, and very often it's not yeast. Very often it's actually bacteria. So when I hear the word yeast, my red lights go off in my brain, and I start pulling out my my soapbox. Because that's just one thing that drives me crazy. Everything is called yeast, and then everything yeast, anti-yeast is being used. And yes, sometimes it is yeast, but you have to really look under the microscope to actually be able to see whether something is yeast or not. And then Johnny, my dog, is currently a patient of Dr. Roman, and okay, it keeps moving on me here. And she is a younger lab that in the past had 2 rabies, a bunch of vaccines, Bordetella, Lyme, antibiotics, blah, 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 all the things that contribute to poor microbiome. She's currently a patient of Dr. Roman's and doing a fecal from her. This journey has been a real wealth of information. Thank you all so much. Yeah, and you're really lucky. Dr. Roman is amazing. I love her, and she's the one who turned me on to poop. So, all right. I think I'm going to stop here. It was really good to have you guys all here. Thanks for the amazing questions that you've asked, and I hope it really helped provide a bit more information. And please share it with others, because there's so many animals that have GI issues, microbiome issues, and there's so many animals that are basically sick because most likely they were not set up properly as puppies and kittens. And so please share the information with all the people that you know, share it with your breeders, share it on your groups, because we just really need to spread the word, because we can't keep going on with this, this health crisis that we have. And for those of you who want more information and want to have me mentor you, let me know. Just start watching the webinar, and then you can kind of follow that. So anyways, great to see you all, and thanks again so much for being here and for spreading the word, because you're the ones who are really in the trenches doing things. So it takes all of us, and I'm so appreciative of all of you guys and all of the amazing work that you're doing and all the learning. So love you all. Have a wonderful Sunday. Bye.